Hello everyone, my name is Adelia Jacobs. I'm a registered dietitian and a master's student at the University of British Columbia working under the supervision of Dr. Maza Jesri. Today I will be presenting my research focused on evaluating the impact of government-led nutrient profile models for the 2020-2021 Canadian National Policy Challenge. Poor diet is a preventable behavior that is closely related to mortality and non-communicable diseases. Reducing the burden of mortality and morbidity through improved health behaviors is essential for reducing non-communicable disease risk at the population level. Health Canada has now identified the food environment as a priority area for action due to its role in shaping population intakes and influencing risk of diet-related diseases. Nutrient profiling is the science of classifying foods by their nutritional composition for reasons related to preventing disease and promoting health. However, lack of evidence on different nutrient profiling models and their validity has been identified by policy actors as a challenge to the development of robust nutrition policies. This lack of evidence on adherence to nutrient profiling models in Canada aligns with gaps in the nutritional quality of the foods and drinks Canadians consume. The need for policy change is urgent, and this research will demonstrate the impact such policies can have on population health and the food environment. Nutrient profiling models have important regulatory applications, such as the proposed policies in Health Canada's Healthy Eating Strategy, which include front-of-package labeling and restricting marketing to kids. Here are images of the proposed front-of-package labeling in Canada. While many other countries have already developed nutrient profiling systems and use them for regulation of marketing and front-of-package labeling. These nutrient profiling models include the UK Ofcom model, the Food Standards Australia New Zealand Nutrient Profiling Scoring Criterion, hereby referred to as FSANS, and the French 5-color nutrition label, also known as Nutri-Score. Here's what the corresponding front-of-package labels look like for each nutrient profiling system. Front-of-package labels tend to focus on the amounts of saturated fats, sugar, and salt in items and translate this nutrition information in a way that is easy for a consumer to see and understand. In this research, these top international nutrient profiling systems were validated and compared at the national level in Canada. Typically, these nutrient profiling models focus on nutrients to limit, such as energy, saturated fat, sodium, and sugar, as well as components to encourage, such as fiber and protein, and the percent of components from fruits, vegetables, nuts, and legumes. The first objective of this research was to apply the Ofcom, FSANS, and Nutri-Score nutrient profiling systems to the 24-hour dietary recall data from the 2004 and 2015 Canadian Community Health Survey nutrition data in order to evaluate the nutritional quality of Canadians' diets. The second objective is to evaluate the relationship between the nutritional quality of Canadians' diets and all-cause mortality and cardiovascular disease incidence, since this data is linked with the Health Administration databases. However, due to restrictions at the Research Data Center in the time of COVID-19, my project has been delayed and I will not be able to present on the full scope of my project, particularly the second objective. As mentioned, I used the 24-hour food recalls from the Canadian Community Health Survey, Nutrition 2015 and 2004, with the survey weights provided from Statistics Canada. The CCHS Nutrition is a cross-sectional survey which represents 98% of the Canadian population. All 10 provinces in Canada were surveyed and individuals of all ages were included. Respondents were asked a variety of questions in addition to the 24-hour food recall, with socioeconomic information collected. The 2015 version was modeled after the 2004 survey and is the most up-to-date nationwide Canadian survey focused on nutrition by Statistics Canada. Exclusion criteria for my sample population include respondents with missing or invalid dietary recalls, measurements, or energy intakes, as well as those who were pregnant or breastfeeding. Of the 35,107 respondents in the 2004 data, the final sample included 31,215 individuals. And of the 20,487 respondents in 2015, the final sample included 19,447 respondents. My final sample included about 50% men and 50% women and were mostly made up of adults. The nutrient profiling systems that were applied to the food composition data for both CCHS 2004 and 2015 nutrition included the Ofcom, FSANS, and Nutri-Score models. All analyses were conducted separately for total nutrient profiling scores from packaged food intakes and fresh produce. The Ofcom and Nutri-Score system assign different front-of-package ratings for scores depending if the item is a food or beverage, while the FSANS front-of-package rating is assigned depending on if the item is classified as a dairy or non-dairy food or beverage and if the item is a cheese or oil and spread. Each nutrient profiling system scores range is different, though generally a lower score indicates a healthier food. Dietary scores for each model were calculated for each respondent's dietary recall, which includes both foods and drinks. Dietary scores were found by summing the consumed energy of an item by the item score for all items consumed divided by the respondent's total energy intake. Each food item was given a food score based on the nutrient profiling criteria. Each food item was given a minimum, low, high, and maximum possible score, though this is not typical of the nutrient profiling models. This was done since our research team did not have access to the ingredient information for the foods reported as consumed in the Canadian Community Health Surveys. An average score was also calculated. This graph shows the distribution of the dietary scores for individuals using the Ofcom nutrient profiling model. The average dietary score was 6. The Ofcom system classifies foods as less healthy if they score 4 or more, and scores drinks as less healthy if they score 1 or more. This graph shows the distribution of dietary scores for individuals using the FSANS model. The average score was 5.7, which is around the 3-star front-of-package rating for non-dairy foods, which is the food group that encompasses the majority of foods consumed. Finally, this graph shows the distribution of dietary scores for respondents using the Nutri-Score model. Only 31,210 respondents were included in the Nutri-Score model because 5 respondents consumed only foods which are excluded in the Nutri-Score system. The mean score is 6.7, which is categorized as a front-of-package rating of C for food items. The graphs I have shown use data from 2004. Unfortunately, the graphs showing the distribution of dietary scores from the 2015 data were not complete in time to be released for this presentation. Overall, each nutrient profiling model showed similar results, with the dietary quality of Canadians tending to be in the middle range for healthfulness. Given the current food environment in Canada and the prevalence of processed foods consumed, these results were expected. Studies evaluating dietary quality using nutrient profiling systems in Europe tend to have similar, though slightly lower dietary scores, indicating healthier diets. As I complete the second objective of my research, I will be able to evaluate the relationship between these results and CVD and mortality outcomes. This research is significant because the choice of nutrient profiling system can lead to significant differences in nutrition policy outcomes. As I mentioned previously, Health Canada has proposed front-of-package labeling and restricting marketing to kids policies. The Ofcom, FSANS, and Nutri-Score models are already used in regulation of marketing to children, health and nutrient content claims, and front-of-package labeling in various countries. This project provides an unprecedented opportunity for advancing nutrition policy research and motivating evidence-based change in Canada. Thank you for taking the time to listen to my presentation.